Okay, think back a couple of days ago after we had all that rain, everyone's heads were exploding, and it's because of all the mold. If you deal with allergies, we have the answer this morning to help you breathe easier. Sue Musgrove is here, and Katrina Zidane from South Texas Sinus Institute. It's good to see you, ladies.
Thank you for having us.
I can imagine you got a lot of phone calls after last week because people, I mean, at one point I felt like my head was going to explode because of the allergies in San Antonio. It's just crazy, and that's a complaint that a lot of people have. So they call you at South Texas Sinus Institute, and they see Dr. Onrubia. And you ladies are here with me all the time. Dr. Onrubia is so busy that it's hard for him to get out here, but we've got a picture of him so you can recognize him when you head on in to the clinic. He'll take good care of us, yeah?
Yes. Absolutely.
And Katrina, you're there too.
Yes, I'm there all the time, exactly.
So how does it work? People make an appointment, and then what happens?
Well, they come in and we evaluate them to see if they're a good candidate. And typically we have a CT machine in our office, and we'll do a CT of your sinuses, and we'll see where you're at.
Okay.
If you suffer from, frequent sinus infections, if you have chronic bad breath, if you can't breathe through your nose, nasal congestion, you get pain, pressure to your face, headaches. A lot of people get migraine type headaches, and it's actually a sinus headache. So come see us about that. We'll definitely work you up and see if you're a good candidate for the balloon.
Let's talk about the migraines, because one of my girlfriends mentioned that to me the other day. She's thinking that her migraines are connected to her sinuses, and she's wondering if something like this could help.
And a lot of people don't put the two together, and we talk a lot about breathing freely and easily. And we've seen some patients that have suffered from chronic migraines. I mean, one patient to the extent she was on several medications, admitted to the hospital, and she just suffered, and she had the procedure done, and she has not had a problem since. So a lot of people don't realize those migraines are actually sinus headaches that they're experiencing.
Let's talk about who you can treat, because I know kids suffer from allergies as well. Can they have this?
Yes, yeah, we've actually, yesterday we did an 8-year-old, correct?
Okay.
Yeah.
An 8-year-old?
8 years old.
Okay,
yeah.
Here's the South Texas Sinus Institute. It's right here in San Antonio. You come in, the folks take great care of you, and basically check you out to see whether or not this is something that can work for you. Balloon sinuplasty, that's something else someone asked me. They're like, Shelley, do they cut? How do they do it? I mean,
no, that's what's so great about our procedure is that it's very conservative, minimally invasive, and so there's no cutting, there's no ripping out any tissue. All we're doing is taking that balloon, we're compressing that tissue, we're opening up the sinuses, we're restoring the natural functioning of the sinuses by just opening up the balloon and expanding that opening. And so it's just promoting the natural drainage of the sinuses. So there's no cutting, and it's less risk of infection.
Okay.
There's hardly no pain, if any. You're up and about the next day, and you're breathing better, and it's just a procedure that you can do in 10 to 15 minutes in our office. Whereas with the traditional surgery, you're out at least a week.
And that's where the people think the cutting comes from. The traditional sinus surgery, people talk about how miserable it was. They packed your nose, they cut out bone and tissue. It was a very painful, very extensive experience. And so when we talk about fixing the sinuses, we need people to understand this is minimally invasive. This is a huge difference from the traditional sinus surgery.
And we get people that have had surgery in the past come to us for the balloon.
Okay. So if you've had it before and maybe it's not working for you, this might be a better option.
Exactly.
Okay.
Yeah.
You know, I do this all the time when my nose is stuffed up and I lift up right here, and all of a sudden you can breathe. That's just like the balloon does, right? I mean, it lifts it up, you get air in there.
And it's permanent, yeah.
Except you don't have to do it with your little hands.
Well, we're excited to tell you, Dr. Onrubia will be here next week, and he'll have some patient testimonials. We're hoping to have a patient join next week on the show, so you could hear firsthand from Dr. Onrubia and from the patient.
Let's talk a little bit about insurance, because that's another question I get from viewers. Is this something insurance covers? How do I pay for this?
Most insurances at this point are covering, and our organization is willing to work with you. You will get the balloon sinuplasty for much less than you would a traditional sinus surgery. Because it's done in the office, you don't have a facility fee, you don't have a lot of the same fees you would have if you went into a surgery center or a hospital.
And you can use your flex spending too.
Absolutely.
A lot of people have those flex spending accounts. This is something that you can use to take care of your sinuses. It's only going to get worse, my friends, unfortunately, right? We've got more rain coming. That means more mold, and then you don't even want to talk to me during cedar season if you haven't had this. Thank you, ladies, so much for being here
Thanks
this morning.
for having us.
This is where you need to go. It's the South Texas Sinus Institute right here in San Antonio on Day Zavala. They're on Facebook. They're online as well. SouthTexasSinusInstitute.com. Call the number on your screen for a consultation, 210-BALLOON. The phone number is 210-BALLOON, or you can punch it in, 225-5666 for more information.